For a fear-free physical exam, the first step is to remove the smells from the prior patient from the exam room. Stressed patients will excrete pheromones that other patients can sense that will heighten their fear and anxiety. So removing all scents is very important. Remember to include the bench where the pets and owners oftentimes hang out. And include the sides of the table. And the floor is also very important to remove fur, blood, and smells. The second step is to spray Adaptil for a dog or Feliway for a feline. And these are appeasing pheromones to reduce stress in each type of patient. Oh, the whole thing. The second step is to spray appeasing pheromones. It's important to spray yourself several times throughout the day. Last step to preparing for your appointment is to make sure that you have everything ready and in the room. Every time you open the door, you're increasing the patient's stress levels and they have to readjust to their environment. So make sure you have your thermometer, your blood draw kit, that you have plenty of treats, and if it's a small patient, that you have the appropriate scale. The treats that we have 3 levels of treats. The first level is the lowest level, the least desirable, and those are the hypoallergenic biscuits. Always try to offer those first. And then the second level of treat is the lean treat. It's a chewy treat, so it tends to be more desirable. And then finally, we have easy cheese. Try to reserve the easy cheese. In a patient who likes all 3 treats, try to reserve the easy cheese for the most stressful point of the exam, for instance, the blood draw. In the room, we get the patient adapted to the room by offering treats and using a considerate approach. Sunshine is bending down to get on his level. She's putting her hand under his chin rather than reaching her hand over his head. She offered the first level of treat, which he is not interested in. Lean treats are piquing a little more interest. And for this patient, cheese was not really his thing either. But that's okay because each one of them offered a pleasant distraction. The second thing she's going to demonstrate is picking up a patient. She has her hand near his head to have some sort of control, but reaches her arm around his body where he's not going to be as threatened. Considerate approach can be used in a physical exam is by obtaining the temperature. It depends on the doctor's preference, but an axillary temperature taken in the armpit can oftentimes be used in place of a rectal temperature because this can oftentimes be a less stressful area for a pet to be approached.
Good job.
Factor in restraining a pet for a physical exam is touch gradient. This means that you're going to maintain contact with the patient at all times. If you let go of a patient in between each part of the exam, it increases their stress levels when you have to restrain them over and over. So either the doctor can do this or the assistant. If the assistant maintains the touch gradient for the doctor, then the doctor needs to get their own otoscope and ophthalmoscope while the assistant maintains hand contact at all times. If the doctor is holding, then the assistant needs to be ready to hand the doctor the supplies that they need to perform the physical exam. In this case, the assistant is going to maintain the touch gradient by gently massaging this patient in non-threatening areas, and he is demonstrating fewer signs of FAS right now with his gentle massage. For your free exam, we may change things up. Typically, in vet school, we always learn to start at the nose and go to the tail, and most of us are trained that way. However, with patients, oftentimes the front of the face can be a more aggressive, or be a more assertive position, and so it might be best to start with the back end of a patient. Starting with the back end, moving up to the abdomen, listening to the heart, and then finally ending with the front of the patient. We'll move seamlessly then into drawing for blood, which I prefer to use the jugular vein, and we've already gotten up to the front of the pet, so they should be prepared. When restraining for a blood draw, the assistant can hold the patient and have the owner stand in front of the patient where he can see his owner, and also have the owner offer a treat. Usually we choose the most highly desired treat for the patient. This particular patient does not really care for cheese, but still having the owner offer the cheese can offer a pleasant distraction. Typically, the patient's already in position for the blood draw from the physical exam, and so the movements to obtain blood are minimal and usually well received. 3 seconds. This is a very important rule to remember whenever you're restraining a patient for a procedure. In this example, we're going to do a nail trim. If Zeke were to start to struggle, we would not allow him to struggle for more than 3 seconds before coming up with a different option for restraint. In this circumstance, we're having the assistant hold him and massage him while performing the nail trim. If he were to start to struggle for 3 seconds, we would stop the nail trim and try something different. Maybe the owner holding while the assistant giving a treat. You don't try for, only 3 tries are accepted. After 3 tries have been made, it's most likely beneficial to stop the procedure, consider your wants versus your needs, and try again on a different day, perhaps with some medication on board.